Good evening, and welcome to Health Plus Weekly. I am Dr. John Podkowa. I'm joined by our co-host, nurse practitioner Hannah Raymond, and we are excited for another episode. Thanks for tuning in. We hope everyone's having a great summer here on the South Coast. Last week, we were pleasantly surprised by the range and distance of how people watching the show. People, I think, tuned in from Colorado was the furthest, wasn't it?
Farthest so far.
Yeah. So again, tonight we'd love to see where people are tuning in from, and if you say hi, I always appreciate it. Hannah and I have a great show tonight. We want to talk about perhaps one of our favorite subjects in terms of primary care and prevention and wellness is helping people quit smoking. We're going to talk about why smoking is bad for us, which most people know, but we'll kind of go over it, and also how kind of working with your primary care office or doctors and nurse practitioners, there's different ways to help you quit and make it a more painless experience for yourself and for your loved ones who are going to go through the process with you. So we welcome, of course, all medical questions, but if you have questions regarding quitting smoking or struggling with quitting smoking, please write in. If you have success stories with quitting smoking, we want to hear about those as well. We hope to kind of really maybe create an online, kind of thread or conversation about successfully quitting smoking, which is arguably one of the hardest things to do.
And one of the best things for you if you can.
Yeah, and one of the best things, honestly, long-term for you, for that. We have a couple announcements before the show gets started. Perhaps most important tonight is there has been a recall of a very common blood pressure medication called valsartan. Valsartan is prescribed to patients who have high blood pressure, sometimes for patients who have kidney disease, and sometimes for patients who have heart failure. And it is not all valsartan prescriptions that are being recalled. It is only certain manufacturers who make the drug. So Southcoast, in an effort to kind of help disseminate the proper information about this, has done multiple things, but you can tune to our website, and right on our major banner there, scrolling across the screen, if you wait for it, there will be information if you're on the medication you can click on regarding what the FDA recommends. But I can tell you also that basically you do not want to stop the medication without kind of discussing it with your doctor or pharmacist first. Number one, you should just probably reach out to your pharmacy to see if the type of medication that you've been prescribed has been affected, because the majority of people have not been affected. Two, if your medication has been affected, you can work with your pharmacy and in collaboration with whoever who's prescribed the medication for you to switch to an alternative medication, because fortunately there are lots of good alternative medications that we can move people to
pretty easily
and safely.
Actually.
Yeah,
yep.
really safely, really easily. That are also often generic and not expensive, and so it can be a pretty seamless process. But most importantly, don't stop taking the medication valsartan. If you're on it, reach out you can talk to your pharmacy. If you want to go to our website, you can find out more information about kind of what the recall entails.
And it's also on the Southcoast Facebook page as well. So if you're on Facebook, don't leave this show, but after it's over, you can go to the Southcoast. For
Southcoast patients, we have actually sent out, for those of us who have a MyChart account, an electronic message contacting you. We've proactively reached out to patients, and we're working actually with our collaborating, kind of partners in care in the community to kind of reach out and address patients who are on the medication. Second, Southcoast is proud to support the Sergeant Sean Gannon Memorial Playground at Campbell Elementary School by donating the net proceeds of special edition t-shirts that are being sold on our online More store. So that's on southcoast.org. There's a More store where you can purchase merchandise, and there's these special t-shirts. The fund is raising money to build a playground at Campbell Elementary School in honor of Sergeant Gannon, who had many connections to the Southcoast health community. So please visit our More store and support the cause. And finally, regarding our website too, in terms of trying to help patients navigate things, Southcoast's IT and marketing department has created a really kind of snazzy digital assistance on the website that you can go to that'll help help you answer questions that you may have regarding whether it's finding a doctor or services offered. So if you go to our website, it's called SAM, and you can also access SAM through Amazon Alexa or Google Assistant. So again, if you go to our southcoast.org website, it's pretty, it's right there. Click on it, check it out, because it's a really nice tool to kind of make navigating our website and the resources at Southcoast a bit easier. And so those are the announcements for tonight. And
we have a couple of A couple of questions kind of off the bat here to get us started. One is from Michelle. She's asking if we could have a talk about the opioid crisis. And I think when we had Dr. Jen Pope on from the emergency room, we had planned to kind of follow that show up with a show about the opioid crisis, kind of the emergency services available, and then also kind of coordinating with some of the other community resources that we have out there. So we are planning to
Michelle,
have a
great
show
idea.
About that. Yep.
We've previously had, if you want to kind of look through old episodes regarding Dr. Holly Alexander in terms of treating opiate addiction, but we definitely can plan to add that because actually we're thinking about our schedule for the fall. So that'd be great.
That's right. David has commented that Chantix helped him quit smoking after 10 years, and he couldn't have done without it. He highly recommends it, and he's been smoke-free for 10 years now, so congratulations.
Congratulations.
David. And we will certainly be talking about Chantix as one of the many options to help assist with stopping smoking. A couple of just other general questions here before we get into talking about smoking. Don has asked, every time he eats a certain food, he ends up cramping in his stomach, and then he gets nausea and has some loose stools. He's 29 years old, and could we give him some advice on what it may be? So kind of a broad, different array of things that could be done. Certainly, you think of any time if it's associated, oftentimes if it's, we think about loose stool, you always want to make sure that it's not an infectious or kind of a more serious cause for it. But if it's been going on for some time and you don't have any fever or chills or substantial weight loss and you're still able to hold down foods, and not having really bloody diarrhea or mucousy or kind of copious amounts of stool that you can't control, we then kind of move on to thinking about some of the other causes of diarrhea and loose stools and cramping. So there's certainly food intolerances. Sometimes gluten intolerance or celiac disease can manifest as abdominal cramping and loose stool. Lactose intolerance. Sometimes there are others more subtle types of food allergies as well that can manifest that way. That would be something that you could kind of get to with an allergy testing panel.
And certainly the food diary is a great way to just kind of jot down how you feel after you eat certain things.
And if you're noticing a pattern in terms of every time you eat ice cream, this happens, and
or milk or cheese, it could be a lactose intolerance. If it's a fatty food, it could be maybe an early sign of gallbladder disease if you're not processing the fat correctly. So it's not terribly sexy or exciting, but just kind of keeping a bit of a log, even on your phone, of when you eat and how you feel, to pinpoint what exactly it is, the foods that you're eating and the time of day, and then you can work with your doctor in terms of teasing it out a bit more.
And there's certainly sometimes just some really easy fixes, eliminating foods, adding some more fiber, that can be easy to help that problem. Another just general question here from Olga, asking that she just found out that she has fibromyalgia. What causes it? And she's waiting to see a specialist soon. The pain is terrible. And what medications could she take for that? So just in general, fibromyalgia is kind of it oftentimes is a diagnosis that is arrived at after kind of an extensive workup, because people generally present with kind of widespread pain and a lot of issues with pain and kind of throughout their whole body, fatigue, and after, usually a workup including thyroid function and any other kind of musculoskeletal causes and
rheumatologic workup as well, arthritis or
if there's an underlying kind of
inflammatory disorder.
Fibromyalgia is usually treated by a rheumatologist and sometimes a pain specialist.
And your primary care, I guess, we manage to, depending
as
on.
well. There are a couple of different antidepressant medications that are used sometimes to treat the pain of fibromyalgia. One of them is duloxetine or Cymbalta, and then there's other medications such as Lyrica, which.
And before that, there's like a host of, hopefully, whether it's certain diet interventions, meditation, exercise, lifestyle,
yoga,
physical therapy,
acupuncture
as well. So there is. Olga, there's actually a long list of potential options for you to start making you feel better, which is the good news.
Right. A question from Stephanie about Lyme disease. What are some of the common symptoms to watch out for? And this is a good precursor. We're planning to have in the month of August Dr. Brian Seeley, our infectious disease specialist, back to talk all about everything Lyme. So just kind of
But certainly we have a lot of Lyme disease in this area. Ticks are ever present, and so kind of red flags for patients. If you develop kind of flu-like symptoms in the summer is a bit of a red flag in terms of fever, chills, joint pains, fatigue. It should raise your red flag that you possibly could have a Lyme infection. There are a few other things that can certainly cause that. There's a very common summer virus that's circulating right now. But if you suddenly fevers, chills, joint pains, just not feeling yourself, it should raise a red flag. Some patients get a rash with Lyme disease. Classically, some people think it's a bullseye rash. Kind of a red with a clearing in the middle. More often, actually, it doesn't look like that. It looks almost like a slapped part of your body, a palm slap on your body. So if you have a kind of a red or pinkish oval or salmon-colored spot on your torso, on your thigh, or on your back, that's suspicious and should get checked out. And then there's some patients who never get the rash, unfortunately, or it disappears before they see it. So in the constellation with the right symptoms, you can talk to your primary care doctor about being tested. So.
Right, good. And so I think we're all caught up on general questions for now. Andrew's watching. Hi, Andrew, and Grace is watching.
Hi, Gracie.
One question from Abby, actually, asking if she can take Benadryl for mosquito bites if she's pregnant. So neither of us are obstetric specialists. I did a little training in pregnancy. Generally, some antihistamines are safe to take in pregnancy. We would ask that you, check with exactly the type of antihistamine that you're taking and double check that with your OB office.
And if possible, even maybe a topical.
A topical first, right?
Because there's a topical kind of antihistamine therapy or Benadryl that you can just kind of rub onto the skin, which should have less side effects and kind of through the body. But you definitely double check with your OB, unfortunately.
Because different, antihistamine preparations within the pharmacy can have, contain different products that we'd want to make sure before recommending that. So all caught up on kind of general questions. That's great. Keep them coming, and we'll try to work them into the conversation.
So smoking.
I know.
Your we work together. Yes, it's
favorite and least favorite things at the same time.
It's probably perhaps like my favorite thing to help patients get done. In terms of significance in improving someone's health, I think it is probably perhaps at the top of the list of things we can help people do to improve their overall health and wellness. And also the people who surround them, because it affects people who, the smoke does not just affect the people who are actually smoking, but secondhand smoke is a notorious, for affecting the health of people who are inhaling it. So the Center for Disease Control kind of ranks 4 behaviors that lead to most of the kind of adult illness in this country, and those things are, number 1 is smoking, number 2 is excessive alcohol intake, number 3 is being overweight or obese, and number 4 is being inactive. So we've actually talked a lot about being overweight in the show and how to exercise. We haven't yet talked on too much alcohol yet. We will in the future, but smoking tops that list, and people don't kind of, I think, have a healthy appreciation of how much havoc it causes. Not just cancer, right?
Right. So we have a couple more people tuning in. Ellen's watching, and Joe and Leslie. So hi, thank you for tuning in. So cigarette smoking, kind of anecdotally, we all know that it's bad for you. In terms of specifics, it is certainly the leading preventable cause of death, not only in the world, but also in the United States.
6 million people worldwide, preventable deaths, and
400,000 in the United States in the year. Yep. And it also, not only that, but it increases your likelihood of developing other diseases that will also increase your risk of dying. That's lung cancer, chronic pulmonary diseases, and coronary artery diseases are the main ones that we think about. But there's also a whole host of other things that are really bad for you and are really closely associated with smoking.
I think, though, in heart disease and cancer, leading causes of death in the United States, cancer just replaced heart disease, I think, in Massachusetts. But people often think about smoking and cancer, but the big, we always emphasize is it's heart disease too. And if you go online, there's different calculators and different things in terms of your risk of having heart disease. And once you add smoking into the equation, it exponentially goes up. And sometimes with patients, we'll do like a fake life insurance quote in the office with them. And if you go down online, if you check whether, if you've ever done it or applied for life insurance, or if you're just doing it, once you put in that you smoke, how much more money your life insurance product costs. And I always joke with patients that if anyone's really, really vested in how long you're going to live, it is an insurance company who's going to pay out. So they're pretty smart about it, and they check very specifically whether or not you're smoking in terms of your urine and different things.
Because they can test for the metabolites of nicotine. So we frequently get requests from employers or insurance companies to run those tests. So it is possible to know. So we kind of in general, we talked about the cardiovascular disease, and we've all heard about the association of smoking and lung cancer, but there are a whole host of other types of cancer that your risk increases from smoking. So kind of topping that second list, aside from lung cancer, is colon cancer. And then there's head and neck cancers, so throat cancer, laryngeal cancer. Which
is one of the few cancers that's on the rise, unfortunately.
Right. So kidney cancer, liver, bladder cancer,
which we see a lot of.
So we do see a lot of. So any things we watch for there are painless blood in your urine. So urine that's bloody without any symptoms of like a urinary tract infection, especially in a smoker. That really raises our kind of red flags there. Certain types of leukemia, so blood cancers, can be increased with smoking. Pancreatic cancer, stomach cancer. Uterine and cervical cancer, breast cancer, and actually to certain types of skin cancer as well. So stopping smoking decreases your risk kind of in different levels of all of those different types of cancer, in addition to the big one, which is lung cancer as well.
Largest risk for developing emphysema or COPD, smoking.
So that's we talked with Dr. Beretti about that, a chronic lung disease which we cannot cure, and we do know that just progresses as time goes on, and can be, can severely limit your quality of life kind of as it goes on.
Reduces our risk to fight certain infections, higher risk for pneumonias, tuberculosis. Prolongs infections. I think that's one of the most common things we talk about.
Delayed healing.
So a viral syndrome or influenza in a non-smoker, they'll get over it faster most often, versus if you're smoking, kind of just delays the progression. So the coughing, just feeling not as great, just persists for several days longer, if not worsens.
And it also increases your risk for a more serious infection as well. So when if somebody has pneumonia that they've picked up in the community, one of the things that we think about in terms of choosing an antibiotic for treatment is, are you a smoker? Because that could certainly increase your risk for a more serious lung infection.
Osteoporosis and hip fracture, especially in women. Smoking just increases your risk.
I think a big one, though, that people don't know is diabetes, type 2 diabetes. So nicotine has an impact on your insulin resistance. So your body can become more resistant to insulin over time, which is one of the mechanisms for developing diabetes. So, it's really a lot of different areas. So you mentioned hip fractures, osteoporosis, and bone density.
Well, obviously oral health, your teeth, gums can be affected by smoking. Ulcers can be complicated by smoking, take longer to heal.
So like a gastric ulcer,
And certainly surgery, and healing after surgery. Certain surgeons are very, very strict about quitting smoking before you go for certain major surgeries, because it absolutely impairs your ability.
And the longer you've quit before surgery, the less likely you are to have complications related to smoking, after surgery. So it absolutely makes a difference how long you've not been smoking prior to having your operation.
And we talked about this last week, but just to retouch it again, unfortunately, it doesn't really matter how much you're smoking either. So some people, kind of comfort themselves, I'm only smoking 1 or 2 cigarettes a day, less than 10. Certainly, the more you smoke, the greater risk there are, but even smoking a couple cigarettes a day puts you at risk for all the things we talk about. So there's really no safe smoking.
No safe smoking, And actually, the longer you've been smoking also raises your risk. But we know that if you quit before the age of 40, kind of the long-term benefits are greater. But then there's also data that shows that if you quit after 60, your
Yes.
life expectancy, and even after 80,
Mhm.
they've, not as quite as strong as data that as quitting younger, but, your life, your kind of total health improves no matter what age you quit at.
Yeah.
Which I think is actually kind of a really important thing. And you had brought up the chart of what happens when you quit smoking in terms of, so we talked
Yep.
about some of the negative effects of smoking, but there are kind of time-related benefits
Yeah.
to stopping smoking. I think that would be.
So within a few days, some of the things that happen that people don't realize is that their sense and taste start to smell and improve again. People actually say food tastes better. They can smell things better. Usually within 1 to 2 months, their coughing often gets better. In the beginning, actually, when you quit smoking, your cough can get worse.
It's worse, right?
Because there are certain things that happen in your lungs that actually they're coming alive again, and so they're kind of clearing out the
Yep.
the dust and the dirt in your lungs. So it's actually your lungs, as they get healthier, actually make you cough for a little bit longer. And then in 2 to 4 years, risk of heart disease begins to reduce. And at 5 years, your decrease in lung function starts to kind of measure out compared to people who've never smoked. Cervical cancer risk falls to that of never smokers. So, like you said, and it spreads out there's benefits to quitting smoking over to 20 years.
Mm-hmm.
So,
Mm-hmm. So one thing that I always hear, so now we know that it's not good to smoke. There's a host of reasons to quit smoking. What are some of the main concerns that you hear from people about not wanting to quit smoking?
I think people, nearly all the people we see or I see in the office don't want to smoke.
Right.
There's very few people who are happy they're smoking. They know it's bad for them.
Mm-hmm.
They often have, children or grandchildren who have kind of tried at them to quit. But it's really, really hard. The cigarette manufacturers have designed cigarettes and put all different kind of chemicals and accelerants in them to make it really hard to quit. And it's not the nicotine that's the problem. That's a little bit dependent, but there's other things in it. So they're kind of a lot of people are embarrassed that they are still smoking.
Mm-hmm.
They're not really proud of it. Many people have tried to quit before and just feel like they just can't because they haven't done it.
It was really hard.
Yeah. And one of my favorite things to tell patients is actually the more times you have tried to quit, the actually greater likelihood that you're going to quit in the future. So so that's because some people say, I tried to quit 4 or 5 times, it just hasn't worked. And I'm like, well, it's actually a really good time that maybe the next time is the right time.
Yeah.
So just bringing it up and asking them about it. It's really amazing. There's really, kind of good evidence that if your doctor or nurse practitioner or someone, you see in the office asks about your smoking and just tells you that's bad for you for even less than 5 minutes and talks about it, increases a patient's chance of quitting.
Every single time.
Every single time. And you may not be ready,
Yeah.
and we get that. I mean, that's part of, I think,
the relationship, the important relationship between.
yeah, and assessing, because people move through stages in terms of being what they call pre-contemplative, so, Steve, do you want to quit smoking? Nope, not right now, doc. I got way too much on my plate. I just, my mother passed away, my kids are, stressing me out, and that's not a good time. Okay, let me know. And then there's maybe, I'm thinking about it, and okay, let's help you get over the edge. And when you're ready, next time, call, let us know. And then there's a time when they're like, actually, I'm ready.
Right.
I want to kind of take control of my life. This is something I could do, and that's where we can step in and help, because there's a number of things. And also, what do you hear when people are afraid to quit smoke? I mean, there's common things like weight gain.
So
right?
we just had a question from Laura Lee about why do people gain weight after quitting smoking? So kind of when I'm going through, kind of the things to expect when you stop smoking, along with all the good things, there are kind of some, I don't like to blindside people with some of the negative effects that can kind of happen, but to be very clear, the benefits of quitting smoking far outweigh any of the negative kind of short-term effects that are actually kind of related to the nicotine withdrawal. So nicotine is a dependent, causes dependency, and without it you can develop cravings, and certainly some of the symptoms of nicotine withdrawal are weight gain, and that has to do with an actual kind of decrease in your metabolism. So there may be a modest weight gain after quitting smoking. I usually tell people, don't worry about it. You're going to be able to walk farther and do more, and kind of we can counteract.
I mean, nicotine or cigarettes are an appetite suppressant. They dull your taste. It's a bit of an oral thing, so you're doing something and putting something in your mouth instead of eating. So there are real things, and then there are certain medications that may help blunt kind of some of the weight gain that we put people on. But it is a factor, and it's something to be aware of.
Right, and some of the other kind of commonly experienced side effects of quitting smoking is you can feel kind of down, you can feel kind of depressed.
Oh, it's not easy. Oh, yeah.
You can feel
Yes.
kind of irritable, you know, if it's been a part of your life for many, many years.
Sleep.
Yep, it can affect your sleep.
Appetite.
You can just feel...
Concentration can come a bit unglued.
And
those symptoms, aren't forever. So the good news is, like, I've never done this, but they probably seem like forever.
They seem like forever. So they kind of peak within the first 3 or 5 days. So I think that's really important to tell people that if you can make it through that first week, you know, the symptoms will get better. And then they end up kind of subsiding over the next 3 or 4 weeks.
And we always, I always try to tell people it's really important to, when you're ready to quit, picking a quit date.
Yeah.
We'll talk about in a second, but it's really important just to say when you're going to do it. Yeah. And I try to tell them, like, you want to do it for you have the best chance of success, whether it's a long weekend, you have a bit of vacation or time off, or the very best, like, just not a stressful time to quit. Because you're going to have, give it a week of rockiness. So I wouldn't do it on a Monday morning if you typically work, and those things. So kind of setting yourself up for success, establishing a firm quit date. We'll get into that in a second, but yeah.
So the good news is that a lot of the symptoms that we talked about of nicotine withdrawal and the things that make people hesitant to actually quit smoking can be relieved or kind of mitigated with some of the options that we can use for drugs that can help people quit. So we'll get into that in a second. So if you've kind of gotten, past that point and you're ready to quit, what's the first thing that you will tell people? If someone's arrived, they say, okay, I'm ready. What do we do? What do we do now?
Yep. So first I talk about kind of what else is kind of going on in their lives. I look at what other medications, and I tell them here are the variety of options. You can try to quit cold turkey, which is the hardest, but people do.
And that's actually the most recommended, not to cut down before quitting, but to actually just stop completely. Yep. And it has it's shown to have the greatest kind of outcome in terms of the longevity of not smoking after that.
And then when we talk about whether there's just plain nicotine replacement therapy, which we'll talk about gums or patches, and then there are medications that you can use in conjunction with the nicotine replacement, Wellbutrin or bupropion, and there's Chantix, which is very popular, and then there's some other ones, and we talk about the pros and cons of those and what that means. And then we talk about, other really kind of strategies. And I really tell people to give smoking the respect it deserves in terms of it is really formidable. Like, no one really wants to smoke who's still smoking. There's very few people. So, picking a quit date's really important. And, usually picking a quit date within the next 4 weeks. If someone says, I'm going to quit in Christmas, I'm like, well, okay, that's awesome, and then we'll make an appointment really closer to that. So, establishing a quit date is super important, kind of a firm date. I tell people to tell everyone who they love and care about that they're going to quit smoking, what that date is. And I tell people, too, is because you can tease out who really loves and supports you based on, like, how they, kind of really support you in that. Because the people who really love you should support you in wanting to do that. Ideally, if there's couples involved, if they want to quit together, that's ideal, or kind of find a friend or, kind of enlist some support because it's great.
And I think that's important in kind of in preparation to quit too, identifying some of those triggers and those situations where maybe you have to avoid them for a couple of weeks.
Yes.
Where if you know that there's a group of friends where you go out to the bar on Friday night and have a couple
play
cigarettes.
Poker, or you
maybe it's a month off from doing that, and that's just kind of let everyone know, and then you'll be back. And
yes, if you can avoid as many of the situations where you smoke as much as possible, absolutely home run there. So just like you said, and then we talk about. But there will be situations that you will not be able to avoid. Like, some people smoke in their car. That's the only place they smoke. And I'm like, well, you're probably still going to get in your car every day. So, you know what I mean? So you got to just think about that and have a plan, in terms of how you're going to do this.
Or if you have those habits too, the cigarette with the morning coffee or the morning break, what kind of developing a strategy for what you're going to do instead.
So it's really important. Are you going to,
because if you're left on the spot to try to figure that out,
you'll fall back on bad habits. So you have to have a plan. Absolutely. So we talk about that. So situations to avoid, situations when you're smoking that you can't avoid, and what you're going to do, and then how you're going to handle stress. Because the majority of the time in my patients who go back to smoking, often it is because a stressor happened in their lives, and they fell back on smoking. And I tell them, like, and I think the literature is a little bit funny on this, but my sense on this is, like, people will start to smoke and feel like, oh, so that's it. and I got to go back on smoking. But no, if you fall off the, you know what I mean, if you smoke, just stop again. Just start. And then certainly telling people you love, getting rid of, making it really hard to smoke. So getting rid of your cigarettes, cleaning out your ashtrays, opening the windows, flushing out your house in terms of, getting the cigarette smoke out, making it really hard to just kind of, as hard as possible to reach for the cigarettes.
Right. And we also know that there's a lot of other things that can help too in terms of not just medications. And so if you set yourself up to be successful kind of with all those things that you just said, but there's other ways in addition to medications and nicotine replacement that can be really beneficial too. Talking with somebody, whether it's your primary care provider or another person who's gone through it, just kind of some type of, we call it behavioral therapy, but just somebody who can commiserate and who can,
we know definitely high touch.
Yep.
Like no one does this alone. It's better to have support. And that's why there's the 1-800-QUIT-WORKS, which works really well.
Right.
Frequent follow-up with your doctor 2 weeks after your quit date. So I try to see people 2 weeks after their quit date in the office to just see how you're doing, what's going on, how's it going.
So I think QuitWorks is a really important thing to emphasize for people. It's run through the state of Massachusetts. If you just kind of Google QuitWorks Massachusetts, it will come up with the website. There's a phone number that you can call kind of at any time to have that support person. So if you're about to go on your break and pick up a cigarette, you can call 1-800-QUIT-NOW, and that will connect you to somebody who can kind of talk you through, and it can also connect you with a lot of resources. They give vouchers for nicotine replacement. They give information about how to quit smoking, and there's a whole lot of resources there. So that's a good place to kind of start too if you're thinking about it.
When I started practicing, which is, I can't believe it's been 9 years since I've been here, but a lot of insurance companies would not pay for nicotine patches or products, which was really discouraging. And even though I would tell patients they are expensive, but not smoking, cigarette smoking is often more expensive. Yeah. But the good news is now, in my experience, almost the majority of insurance plans are covering nicotine replacement, patches and therapies, gums, lozenges, and a lot of the medication we use to quit, which is really great.
And there's also some financial incentives through health insurance programs and also through employers as well. And those are another couple, kind of the non-medication
I love to talk to patients about that.
Yeah.
I have patients who have leased like a BMW because of what they've saved on
health
cigarette
insurance,
smoking. You know what I mean? Like just like instead of smoking cigarettes, they put that money, they've gone on trips. And we talk about that, like, what are you going to do with the money when you're spending, $10 a day, it's $300 a month, and $3,600 a year? It's a lot of money.
Right.
So, and that's, there's so many wins for quitting smoking when you kind of lay it down. It's pretty awesome.
Through everything, not just health-wise.
Yeah, financially as well. So we talk about it and we kind of get them motivated. We have them pick a quit date, ideally within the first, kind of month. And then we set, and I also tell them it's about a 4-month process, really, in terms of about it. The first week is really rough. The symptoms of nicotine withdrawal go on for about, the first week and then about another month. And then usually what it is 2 weeks if I had to design my ideal plan for a patient, it's a combination of medications and nicotine replacement, and you kind of wean them up and then wean them down over about a 4-month process. Okay. So people wrap their mind around that and just they know kind of what to expect.
So should we talk about some of the, we have a couple of questions here. We'll get caught up here. Another question about kind of opioid pain medication, the crisis, and we're going to have another conversation with Dr. Pope and some of the resources from the local emergency rooms and community resources about that upcoming. Question about what are physicians doing now to prevent overprescribing?
There's a lot. One of the most important is that there's a prescription monitoring program in place that we are licensed in terms of Massachusetts. We are required to look at to make sure that people are not being prescribed kind of controlled substances from multiple different doctors. There is new studies and just a general consensus in terms of how best to treat pain and just kind of limiting opiate therapy. Pharmaceutical companies, are very much on board in terms of reducing, the kind of the time and space where these are, prescribed.
Available,
There's still a
yeah.
good, there are appropriate reasons and situations when they're prescribed, but we're really kind of changing it. So it's definitely a pervasive attitude. And I think there's good news on that. I think the number of prescriptions are going down,
Yep.
and the tide is shifting in the right direction. Certainly, in Massachusetts is one of the best states in terms of, kind of preventing the spread of the epidemic. It's still very much here and alive.
Right.
But some good things are happening.
And a good follow-up question to that from Kim is, which non-opioid pain medications are good for chronic back pain? We recommend, of course, in the absence of kind of any contraindicated, other conditions that you have, like an ibuprofen or any of the NSAID medications over the counter, taken with food for kind of a short period of time can be safe.
And then for, when we usually like naproxen first. I think it's the safest, which is Aleve, ibuprofen like Motrin. And then also, depending on the right people, like Celebrex is also a really effective, kind of anti-inflammatory
kind of
pain medication. It's a little bit stronger.
Higher intensity.
Yeah, you can talk to your doctor about, absolutely.
Tylenol is certainly a good stretch, but then we also know for chronic low back pain, there's kind of a mounting body of evidence that physical therapy, core strengthening, and a lot of different of those other modalities that are not medication at all are just as effective in treating pain and kind of preventing, exacerbations of the pain.
Yeah.
So more on that to come. Great questions. We have Sandy tuning in, and also Sherry. So hi guys. Thanks for watching. Sherry said that you're number one. Good topic tonight, and yes, support is number one. So, hopefully we can motivate some people tonight to start the conversation about quitting smoking. Maria's also watching.
Hello, Maria.
So
increasing your chances of quitting smoking. So when the rubber hits the road, how can we make people do it? And how can we do it where they don't drive themselves crazy or the people they love ones crazy? And I think it starts with nicotine replacement therapy, because that helps mitigate a lot of the symptoms.
Right.
And people worry about, one, is the nicotine bad? And the nicotine really isn't that bad for you. That's not what's bad about cigarettes. It's what helps get you addicted to the cigarettes and keep you addicted. But taking nicotine replacement therapy, whether through a patch and or lozenges, which we'll talk about, really safe, really effective, stable. It's safe for people who have heart disease. In the past, there was some fear of people who had heart disease. Is it safe? In the setting of stable heart disease, it's fine, in stable illnesses. In the setting of someone who recently had a heart attack or hospitalized, which we won't get into tonight, that's a bit more nuanced. But this is about people who are on the outside, visiting us in our offices. We want to talk about nicotine.
And there's certain, so there's gum, and these are all available over the counter as well. So there's gum. The patches can be prescription as well. Everything can also be prescription as well, depending on your insurance. So let's talk about the patches a little bit. There's different doses of the patches, and so kind of if somebody who smoked a pack of cigarettes a day, there's 3 different doses of the patches. There's 21 milligrams, 14, and 7. Where would somebody kind of want to start with that?
A few questions regarding that. I usually talk with, number one, kind of level of addiction. So I usually ask, after you wake up in the morning, how long before your first cigarette? If someone smokes within an hour before they're waking up, I put their level of addiction pretty high.
Okay.
There's some debate about that, or timing and different things. But that's how I start. After you wake up, how long before your first cigarette? And then there's a wait. But for adults, most of the people are the same. So if someone smokes a cigarette before the first hour of their awake, I usually start them with a 21 milligram patch, the highest level. And my protocol typically is 2 months at 21 milligram patches, then step down to a 14 milligram patch for a month, and then 7 milligrams patch for another month, and kind of wean them off. And that gives you a basal rate, or kind of a baseline rate of the nicotine in you. And patches are effective in terms of cutting the cravings. There's no free lunch. There are side effects. Most common side effect is it can irritate your skin.
Yep.
And
sometimes if you wear it overnight, because they are 24 hours, they can cause some kind of vivid dreams as well.
So really good point. So pros, cons of wearing it overnight. It can definitely cause a little bit of insomnia. It can definitely kind of give you your dreams, and it can irritate your skin. However, for the people who are smoking first thing in the morning, by taking it off before bed, the nicotine level falls within your bloodstream, and you're at higher risk for smoking first thing in the morning, because when you put the patch on, it doesn't kick in right away. Moving the patch around on your body dramatically reduces the risk of the skin irritation. And actually, over-the-counter kind of topical hydrocortisone cream is a really safe, simple way to kind of help alleviate that itch in that patch. And in addition to the patch, then also is recommended kind of a secondary kind of a, nicotine replacement, whether it's gum or lozenges, which is really effective. They help not just because of the nicotine that you're getting, but also the oral, the
fixation
habit
of it.
of like having something in your mouth, chewing something which is a major kind of habit that needs to be broken for people who smoke.
Right.
And that goes based on, again, how often you're smoking, what dose gum or lozenger that you want to do.
Can you combine the patches and the
It's actually
lozenge as well?
encouraged. Yeah, so that's what you
so
want to do.
long-acting and a short-acting.
Long-acting and short-acting is the best for kind of helping you get through. And that's often why a lot of times people will fail from smoking, is they start with one or the other, and actually kind of combining the two is really effective. Yeah.
Because you're addressing kind of both aspects of the addiction, the nicotine withdrawal, and then also kind of the fixation of, the habit of that.
And the gum's a bit tricky. You have to chew it slowly to release the nicotine, because then it'll get absorbed through your gums. If you chew it too fast, it can kind of dump into your stomach and upset your stomach. I don't think it tastes terribly great from what I've heard.
I think it's Orbit, but it's okay.
And so the lozenges, some people like a bit better. The problem with the lozenges is you have to kind of maybe use a fair amount of them going through the day. But very effective. And so by adding nicotine replacement, increases your odds by 50 to almost 100% better. 1.5 to 2 times more likelihood to quit, which is great.
What are some, and there's a couple of other, there's the inhalers or sprays as well?
Yeah, there's nasal sprays. I actually don't have that much experience in
with
prescribing with them. I stick to the lozenges and the gum. It's kind of where my kind of safety spot is, but there are other modalities.
Okay. And then kind of not second line, but in addition, and right for some people, there's oral medications that aren't nicotine at all.
No.
So what are some of those medications? What are
the two major ones, Chantix on the market now for several years, and that actually it works. It's a pill. You take it. It works in our brain. It blocks the parts of our brain that are activated by nicotine, so you don't get the kind of pleasurable response to smoking that you did. And it's the most effective oral. Kind of to increase your chance of smoking by 3 to 3.5 times. So, and it's really, I'm not sure your experience, really well tolerated. And that it is, so there's a starting dose that you once a day, twice a day, and you go up, and there's twice a day medication, and you stay on, and you can or cannot use, depending on what you want to do, nicotine replacement with it.
Right.
And it's really effective. People just don't want to smoke anymore. It kind of helps, kind of get them off of it.
And the duration is about 12 weeks. So like you said, kind of that 4-month period.
Commit to it.
And then you'd be coming off of it.
There was, when it first came out, there was some concerns that it increased maybe suicidal behavior, depression, and the FDA did initially put a warning on it about the medication in terms of people who are depressed, people who have to be careful with it. That actually got taken away in 2016. They did more research that showed it was not the case. So it's safe to use. Of course, every patient is different in terms of what other medications are on and kind of medical conditions, but overall, really effective, covered by a majority of insurance companies. And it definitely can give you some bit of vivid dreams as well. There are some side effects to it, but
I used to work for a ENT doctor, and they would see a lot of singers and a lot of kind of performing artists, and we would, smoking cessation was a huge part of a lot of their treatments there. So we used to joke that a lot of students at Berkeley would come in, and we would start them on Chantix, and then they would get inspired to write great music by their crazy dreams. So that was one benefit of that as well. So what's another
other medication? The one is Wellbutrin or bupropion, or there's I think the name for it is Zyban. So this actually was originally an antidepressant medication that kind of works in the brain as well. It kind of regulates the different kind of chemicals in our brain that modulate mood and pleasure, and it helps lower our desire to smoke. Is kind of the best way to I think kind of explain it. I use it in conjunction with nicotine, really effectively. So the big red flag for people who can't use Wellbutrin or bupropion is if you have a history of seizures, because it can lower your seizure threshold. So that kind of eliminates it. But otherwise, it's great. Side effects, it can cause a bit of insomnia as well, because it's a bit of an uplifting and a stimulant medication. and it can affect dreams. So it's really good, though, for people who have some depression going on as well, because it works really effectively. It helps very good with concentration. And perhaps one of the main reasons I really like using it, too, because it really helps kind of mitigate some of the weight gain. Actually, in women more than men, too, that sometimes they see it, so it's really effective. And that dose usually is, we do like a 2-week run-in before they quit smoking. So we have them start it about 2 weeks before they want to quit smoking. So you have your quit date, you start the medication, you start usually 1 pill a day for the first several days, and you go up to twice a day, and it's a twice-a-day medication for the 4 months again. And a lot of people stay on it.
Some people stay on it,
yeah. They really enjoy it.
Yep.
And
because
then
it is an antidepressant medication as well, kind of an atypical. So
I tell them then on your quit date, you continue on with the medication, and then you add your patches, and you're off and running. So it's kind of a threefold attack in terms of the medication, the patches, and then you kind of your lifestyle medications, which I kind of give people homework to write down what they're going to do in terms of kind of in these situations of who are they going to avoid. When they can't avoid it, what are they going to do for the strategies and strategies for getting back on the wagon after they kind of mess up and smoke,
which is okay,
which is fine, which is normal. So
that's great. So any other, there's no real other medications that we use kind of. Yeah,
there are others, like second line, some other antidepressants that, can be effective or not. When people don't succeed, from smoking and quit, several things happen. They may or may not have been ready, so that's okay, kind of reassessing, sometimes taking a break. Sometimes they aren't taking the medications appropriately, so that's really important to know. Sometimes they get side effects from medications, so sometimes like the Wellbutrin, they have trouble sleeping, so they want to stop it. But oftentimes it's lowering the dose. So instead of twice a day, I lower it to once a day. And the benefit's still there, and the side effects kind of go away. Same thing with the Chantix. So sometimes the side effects of the medications, and so we often can lower them and still get most of the benefit. So it's important. So
that's where kind of the close follow-up comes in, where if you have people come back within 2 weeks, the medications
see how it's going.
Taking effect, and kind of we can reconvene and see how everything's going, or sooner. I always tell people, if you're feeling like you're hitting a wall and you want to come in sooner, let us know. We'll do our best to do that. So we have, let's see, Sue's watching. Hi, Sue Sherman. She was one of our great guests. Get ready to come back. And then just some general questions, but all caught up in terms of smoking.
Just a couple things about smoking, though, real quickly. So, there's no good data on it, but people get hypnotized, and they ask me about it. I say, if you can afford it, I don't think it's dangerous to try. There's some success in that. Acupuncture,
Who's
maybe.
the guy around here that I think he's?
I'm not sure.
I think he's. If you Google Russian hypnotist, I think there's somebody around the area that I've heard of.
So that's helpful.
Acupuncture, you said, is sometimes helpful. Yep. Again, things that no strong data on it, but certainly not super risky in terms of trying it out. And if it works, that's wonderful. Yeah.
And then also kind of motivational in terms of like, where do you want to be in 3 years, 5 years? How do you want to be? And just recognizing whether you want smoking to be part of that. Would its influence on how your children see, your grandchildren, because it affects their lung function, spouses, your loved ones in the house, because just having an increasing awareness of that, this is just not just affecting you, this is affecting other people's health as well.
One of the most common reasons that people cite with me for wanting to quit smoking is grandchildren. Just kind of realizing, wanting to be around for a longer time is a great motivator. Sue had a great idea here: replace the habit with a good habit like walking. So if you're craving a cigarette, out for a short walk, and that's that. So great idea.
What I love about smoking and getting people to quit smoking is it's often a keystone habit. So they will quit smoking, and then other things start to fall in line. They gain self-confidence because willpower is buildable, and then exercise often starts other lifestyle changes because you feel better, and so it's really, really an empowering thing for patients to do, so it's neat to see. So so sometimes they start walking and they really just turn it around. I actually saw one of my patients this week who was one of my first patients. He's doing amazing. He quit smoking, he's fit, he hikes, he just was like a complete lifestyle turnaround. One of my other patients who frequently watches the show, we talk about, same for her, she quit smoking and has had some uphill battles afterward, but if she was smoking, it still would have been a lot harder. So it's great. And people are really, and I try to congratulate them, like, quit smoking, it's great.
It's a huge accomplishment.
Yeah.
So kind of the long and the short of it is we know how bad smoking is for you, not just for your lung function, but for a variety of other kind of negative health effects. There are some side effects that you can anticipate with quitting smoking, but we know how to handle those, and the good news is that they do lessen over time. In kind of the lead up to smoking, there's a lot of work to be done in terms of setting yourself up for success, finding the triggers, how you're going to deal with situations, and then talking with your primary care provider or anyone who will listen to you about kind of the strategy for quitting
or just
smoking.
calling 1-800 quit now, right?
Yep,
Quit Works. They'll get you plugged in. You don't have to see your doctor.
Right,
you don't need a copay. They will help you.
We do know that the combination of talking, kind of behavioral therapy, and some nicotine replacement, as well as if appropriate, one of those two medications, whether Chantix or the Wellbutrin, can be helpful and increase your chances of a successful attempt at quitting smoking.
And every time you try to quit and fail, that increases your likelihood the next time you try to quit
is
going to be your time. So don't get discouraged and keep trying.
And we'll talk about it as much as you want on this show as well. So we have one question again from Rebecca, just a general medical question about tick bites. She said it's a good subject, and so we are planning to have a show kind of in August about that with Dr. Brian Seeley, especially in this area. She said since the bullseye rash is not always evident with every bite, when should you go to the doctor if bitten? So I think Dr. Pope had actually mentioned a good kind of rule of thumb on that. People tend to come in kind of for any tick bite, but we do know that in order to transmit tick-borne illnesses, the deer ticks, the infected ticks have to be implanted for kind of a pretty prolonged period of time, 36 hours, to actually kind of transmit the diseases. So if the tick has not been implanted for that long, the likelihood is low that you've contracted and
the best way to remove them is again with a piece of pair of tweezers. You try to grab most of the body and you pull it out. You don't have to worry about getting the head, and it'll fall out. And if you're unsure how long the tick has been on you, you can call your doctor if you have no symptoms, because there is for adults, for most adults, there's a really simple kind of 2-dose antibiotic regimen we give to help even further reduce your risk of getting it.
Right. And the follow-up question that Rebecca had was, should a person that is outdoors, fishing, hunting, etc., be evaluated routinely for Lyme disease or other tick diseases? So I don't know the exact kind of recommendations on that. In the way that I practice is no.
No, not without symptoms.
No, not without symptoms. Because kind of, as I also like to remind people, the tick testing, it's not just a clear black and white, yes or no, you have it, you don't. It's a little bit more complicated, and we always combine that laboratory data with the symptoms that you're having. So, a positive titer of a Lyme disease, if you've had it in the past, doesn't always tell the full story and actually may complicate things in terms of how we would treat you. So if you're in a high-risk area, which kind of everybody who lives in Southcoast is, and you've been bitten by a tick, or if you kind of develop those symptoms that we talked about earlier, it's best to seek care again.
Good.
So, she's asking to describe tick bite symptoms. So the actual tick bite, sometimes you can have a very small kind of local reaction around the tick bite, which a lot of people confuse for that bullseye rash. But most of the time, it's actually just your body's local reaction to the saliva of the tick. So you can have a small red ring around it, which is not actually the bullseye rash, but is concerning certainly because it looks exactly like a bullseye. Other symptoms to look out for, flu-like symptoms, kind of that headache is a big one, fever, chills, body aches, joint pains, and any skin rash is a sign of early Lyme disease that would kind of warrant getting checked out, especially if you live in this area. So more to come on that, Rebecca. And I think that we are all caught up in terms of questions tonight.
That's great. Thank you, everyone, for tuning in. Thank you for the questions. We can't say it enough. So if you know a smoker, if you are a smoker, please share the show, tell them about the show. 1-800 Quit Works. It is perhaps our greatest service that we can do to help people in the community quit smoking, because it's the number one risk for risk of death. So.
And it's pretty fun for us too to
kind
of to
it'll be a
tag
good,
along
it'll
with
be
you
a
on
good
that.
day when we don't have to talk about people quitting smoking. So And it's been successful. People are smoking less over the years, so we know we're being successful with it. Anything else from your vantage point?
Nothing here. Do you want to reiterate the
just one last thing regarding just kind of touching what we opened the show with, in case you're tuning in late. There's been a very important recall on a very common blood pressure medication called valsartan that a lot of patients are on. If you go to the southcoast.org website, we have information regarding what the recall entails. If you are a Southcoast patient and on the medication, we have sent out a message either via MyChart electronically to you if you have a kind of like an electronic account with us, or we'll be sending letters out you'll be receiving soon. It's important just to not stop the medication valsartan if you're taking it. Not everyone who's taking it will be affected. Only, I think, 3 major pharmaceutical companies who are manufacturing it are kind of involved with the recall, and we have lots of great, safe alternative medications to switch you to. So southcoast.org to check out more information about that, and check out your MyChart account or check your mail if you get a letter from Southcoast to see. Also, if you have questions, you can certainly reach out to your pharmacist or your primary care doctor's office. Again, speaking about the website, the Moore store, we at Southcoast is pleased to support the Sergeant Sean Gannon Memorial Playground at Campbell Elementary School. T-shirts proceeds will go to help support that, so please tune in and support a local hero. And also, if you need to navigate or have questions regarding Southcoast, on our website now we have a new digital assistant named Sam that is pretty nifty to try out to help answer your questions. And actually, you can access Sam through your Alexa or Google Assistant, and that's on the website as well. And with that, I think we're done.
We're done, yeah.
We hope everyone's having a great summer. We certainly are. The weather has been great. I can't believe it's almost August. I'm a bit disappointed in that. But we will see you next week. Stay healthy, Southcoast.
I started dancing at age 3, and I kept on dancing. I never stopped doing things. I liked to travel. I was walking in Iceland, and it was very painful. Not only are you in pain, but it's the fact that, oh, I don't think I better do this. I could create something that's worse than I have right now. And I really thought, I hope someone will listen to me. And that, I think, is the most important thing. And I was asked, what would you like to be able to do? And I said, I want to be able to do everything. I want to be me. I want to be able to walk. I want to be able to climb. I want to be able to dance. And I want to be able to feel secure. Southcoast listened to me. I felt that it was my decision. I was in control of the situation. I felt a lot better about it. After the procedure, you feel liberated. You feel like you are your own person again. It's a wonderful, wonderful feeling. I've had good care. I've had people to answer all my questions. I feel secure. I had surgery up in Boston at one point in my life. The care that I received here was far superior, and I just felt like I was home. I'm walking with a brand new hip, and it's doing very well, and I feel good. I'm back to where I want to be. There doesn't feel like I have anything that I can't do. When I was at the Jazz Fest and I heard the music and I started and I thought, you know what? I'm dancing again.